The World Health Organization added a new definition to its handbook of disease, and it is tied to burnout.
So if constant stress has you feeling completely exhausted, helpless, and overwhelmed, you may be on the road to burnout. So to learn more, we have to bring in our health reporter, Rosemarie Beltz. What can we learn, Rose?
Well, okay, so a couple of things. Burnout, that term has been around since the 70s, right? So a German psychologist coined it back in New York when he was dealing with healthcare professionals, exhaustion, extreme fatigue, etc. Now, as far as the World Health Organization goes, they're looking at it as not actually, so it can be confusing. As far as disease goes, it's more or less a factor contributing to disease. And as far as if we're more stressed now than we were, say, 20 or 40 years ago, that's a really good question, because stress is at sort of the root of burnout, but stress we can control. Burnout, we can't. We're feeling helpless, sort of to that point of exhaustion. And then looking at statistics, so it's kind of hard to say if we're more or less burnout at work because we measured it differently. Startling though, 50% of people say that their jobs are very stressful. 25%, so 1 out of 4, say that their job is causing their stress. But what we do know is that the ailments that are kind of coming along with this. Does that make sense?
That makes sense. Are some people more at risk than others for burnout?
Sure. So right out of the gate, if you can't control your situation, so they're looking at it from a managerial point of view. So kind of hitting it from that angle instead of who's kind of affected under this. Well, so if you're in a situation where an environment that you can't control, you don't really have a clear job description, and it's sort of a kind of an interesting work dynamic, whether you have some stronger personalities than others. Who's at risk? Well, people that are maybe certain personalities. Maybe you are a people pleaser. And some people, or maybe you are naturally more pessimistic, but basically you can't manage that workload. But again, this is sort of coming from that standpoint of the workplace kind of situation, kind of looking at it from that angle. So not so much outside stress, or maybe you per se, but maybe the situation that you're in.
So if you are burned out, if you're feeling these, these symptoms here, what are the consequences? I guess what comes with burnout?
Right. So, sometimes we feel a little tired, overwhelmed. Again, that's stress. But if you get to the point where you're waking up, it's like, today's just not a good day, right? Every day doesn't seem to be a good day. You have your mental and physical implications of stress, right? So now we know heart disease, blood pressure, diabetes are some of the physical implications, right? So, but again, that feeling of just kind of hopelessness, and our family should be our support system. The last thing we want to do is kind of go home and take that stress into our families.
So if this sounds like you, this is a good time for you to maybe make that doctor's appointment for Tuesday or Wednesday morning and talk to your physician about it.
Right, because when you have to start self-medicating, whether it's, having glasses of wine or even with food, you definitely check in with your doctor.
And it is preventable too, so that's always
Yes.
good. Thank you, Rosemarie. Stay with us, more Friends at